So welcome to tonight's Farm Advisory Service webinar, where we'll be discussing livestock winter health. So this is the third in the new entrants winter webinar series, and I am Laura Henderson. I'm an agricultural consultant with SEC Consulting, and I'm based in Elgin, and tonight I'll be the chair. Our guest speaker for tonight is Megan Ferguson, a veterinary investigation officer with SIUC based in Ayr. And we're also joined by Jack Joe, who will be acting as producer to help with any technical queries we may have throughout. So in the next hour, Megan will take us through cattle pneumonia, worms and fluke in cattle and sheep, pine pasteurellosis in lambs, and the value of screening cull yows for iceberg diseases. So I think just before I hand over to Megan, we'll run a quick poll to get an idea who we've got in the audience tonight. So it should be on your screen just now. What is your background? Are you a new livestock keeper, an experienced livestock keeper, just thinking about getting some livestock and just kind of here to see what you're letting yourself into, or are you none of the above and so therefore fit into the other category? So tonight's audience is 59% of them are experienced livestock keepers, 28% are new livestock keepers, 10% fit into the other category, and the remaining 3% are just thinking about getting some livestock. So I'll just hand over to you, Megan.
Okay, great. Thanks very much, Laura. And thanks very much for asking me to speak tonight. I'm always glad when somebody hopefully wants to listen to what I've got to say. So as Laura said, I'm a vet. I work down in not so sunny Ayrshire. My day job is with the SRUC Vet Services, so basically doing postmortems and disease investigations on farms with vets in practice and farmers working together to get to the bottom of disease outbreaks. So that's my day job. I grew up on a dairy farm and I'm now married to a beef and sheep farmer, so I've kind of got a finger in all pies in all areas of livestock. So hopefully tonight I've tried to pick out some really practical things that you can take away and implement on your own farms. I think a lot of these talks can get too academic, so I've tried to go more towards the practical side. So hopefully that will work for you. Now, as I'm talking, I'm going to turn my camera off because as I start flicking through slides, I start to sound a bit like a robot because our internet's not great. I am in Ayrshire, but I'm in the hills of Ayrshire, so I'll just turn my camera off and I will pop it back on at the end to come back and say hello again. So we'll stop sharing that just now. Right, so let's get going with these slides. Okay, so if any of you have ever been at any pneumonia talk, I've absolutely no doubt that you'll have seen this picture. It is a wee bit overused, but it demonstrates the point beautifully, which is why it's used so much. And the point is that there needs to be a balance with pneumonia between maximising immunity and minimising pathogens. So this in itself could be a whole day of talks, and in fact next week we're doing 2 days just on this subject for vets, so there's so much to cover in here. But just for tonight I picked out a few points that as I was saying aren't particularly academic, but hopefully I've tried to pick out points that are practical and can be easily implemented on farm, just with aim of trying to maximise that immunity and minimising pathogens to get an overall picture of reducing pneumonia outbreaks on the farm. So we'll go through these points individually and see what we can pick out. So first of all, we'll think about how we can reduce pathogens. Now, the bottom line is that these pathogens are everywhere. And here I've put up just some of the very common bacteria and the common viruses, which I'm sure many of you will have heard of already. But basically they're everywhere. They can be found in the throats of healthy animals as well. So basically you're never going to get rid of them off your farm, with a few exceptions. For example, IBR. It is possible to eradicate IBR from a group of animals. But as a general rule, a lot of these bacteria, especially your Mannheimias and Pasteurellas, live at the back of the throats of healthy animals, so they're there all the time. And these are just a few of the most common ones that can be involved in pneumonia outbreaks. So basically, yeah, they're about all the time. We can't really get rid of them. We just have to deal with them. One really important point that I always think is quite crucial is that pneumonia, the word pneumonia is an umbrella term, and it describes the symptoms caused by these pathogens rather than being a specific diagnosis in itself. So the word pneumonia doesn't diagnose what is causing that pneumonia. There will always be something causing that pneumonia, but pneumonia is what we see externally. So when pneumonia is diagnosed, it could be being caused by any one or a combination. Combinations are more commonly involved of any of these pathogens. And in some cases, it is really crucial that we nail down exactly what's causing the pneumonia, but in other cases, it's not actually that important if there are other things that can be altered before we get to that stage. So we'll come on to this in a wee bit, but I just think it's really important to think of pneumonia as being that umbrella term rather than being a single, that's exactly what's wrong with that animal. So the first really straightforward way to reduce exposure to pathogens is to avoid mixing ages at housing. So more than ever just now, we're all well aware of the disease risks of mixing ages in human population, but in the calf shed, it's the youngest calves that are the most vulnerable. So as we already said, many of the bugs that cause pneumonia are in the environment and in healthy animals. So older animals will often have developed immunity to them. And these older animals are the ones that can carry these pathogens. They've already come across them, that they've developed immunity to them, so they're not causing them any problems, but they'll carry them about and they'll pass them on to younger animals who will have little or no immunity. And this is what leads to an outbreak of pneumonia in a shed. So it's really important to house in terms of ages and not size. So the older animal that is the same size as the younger pen is the very one that is likely to have had pneumonia and have chronic lung damage, and it be at greater risk of passing bugs on. So if you're bringing your animals in and you think, well, that calf's not done as well as it's, the rest of the group, we'll just bring that down a pen. Don't do that. That is the worst thing you can do, because all you're going to do is bring lots of bugs into that younger group of calves and put them at risk. And this is where a tight calving period and even batches of calves really comes into play from a veterinary point of view. Because I appreciate if you've got an all-year-round calving pattern or quite a spread calving pattern, it's really hard to group calves, especially weaned calves, as you're bringing them into housing. And I realise that it isn't always practical to have purpose-built sheds for each stage of animal. But pathogens can also travel through the air. So cows over the passageway from young stock, or the youngest weaned calves, would also be a risk, because those cows are sharing the same airspace, so those pathogens can travel through the air. So they don't always need nose-to-nose contact. And an important thing to remember about all these points that I'm making tonight is it's not that we can all do the gold standard. That's not always possible. But if we understand the reasons for these things being important, we can do what we can to sort of mitigate these risks. If you're buying in stock, think about the difference in disease status between the two groups. So it might be, for example, that you don't have IBR on your farm, so you've got your homebred ones there, your green ones, they're IBR free, not accredited free, not certified free, but they've just never come across it because you've not bought it in. So your homebred animals have no immunity to IBR, and I'm just using that as an example. And then you buy in these chaps who might have been exposed to IBR. Doesn't mean to say that they've become clinically ill from IBR. They might have come from herds where IBR is endemic and they're carrying the virus. So you buy them in and you house them together, and bingo, you've got the absolute perfect recipe for an IBR outbreak. Because what will happen is these bought-in ones will pass it to your homebred ones. They've no immunity to it, and you'll just get a classic outbreak where you get you can get sudden deaths, you can get horrible acute pneumonias, and subclinically you'll get reduced growth rates, reduced milk yields, all that sort of thing. Or it might be the other way around. So it's not always the animals that you buy in that are the risky ones. So it might be that your homebred animals are the carriers. So there's IBR endemic in your herd, and it doesn't cause any problems because the virus is there, and they come across it at a young age. They maybe get a little cough, they develop immunity to it. And it might be that the bought-in ones are the ones that have never come across it. So again, you house them together. You've got the perfect recipe for an IBR outbreak. And every winter through the post-mortem room, where we do our day-to-day work, we see outbreaks of disease involving multi-source sores, basically, coming in and mixing with home-bred animals. It's often a feature in the history that we get where there's been an outbreak of not just IBR, any pneumonia. So there's just been mixing of animals, and you have to think about, you're buying those animals in, you're also buying in bugs within those animals, they're all mixing together, and then you get a pneumonia outbreak. So again, just like we're saying, you can't go and build new sheds. We're not saying don't do it. We're not saying don't buy in. Just think carefully when you are buying in about where they're coming from, how many herds you're sourcing them from, and when you bring them home, what stock are they being housed with? And if you are buying in, I would probably discuss vaccinating with your vet, just so you can try and avoid a disastrous pneumonia outbreak. It's often something that once you've had on your farm, you don't want to have an outbreak like that again, so you'll take preventative action. So at this point, I'd usually get you all to stick your hands up. So we'll do a virtual hands up. Who has heard of the stack effect? So hopefully some of you will have heard of it, and hopefully some of you won't have heard of it, so that I can tell you something that you haven't heard before. So the basic principle of the stack effect is that body mass in a shed, and animals breathing in a shed, pushes air upwards. So you can see the red arrows going upwards here with the air. And then as this air leaves the shed, at the top there, fresh air is pulled in from the sides to replace it. And this leads to really good air circulation within a shed. And this is what keeps good airflow in a shed, keeps pathogens to a minimum, because the pathogens, so all the bugs that cause pneumonia, are pushed up outwards with old stale air, and then the fresh air is replaced in the sides. But what you need is that outlet at the top to generate the air coming in from the sides. So if you don't have that outlet, you're not going to get the air coming in from the sides. If the outlet is too small, so it might be there, but it's too small, then again, enough air won't be drawn in from the sides, and pathogens will linger above this animal here. So they'll linger in the shed, and then the animals are just going to be at more risk of breathing them in and then becoming clinically ill. On the other hand, it might not be the outlet of the shed that's the problem. If the inlets are not big enough, so the inlets are the ones at the side, so they might not be big enough, or they might be big enough, but you might have built another shed beside it, so the inlets are blocked. Might have sat empty all summer, so cobwebs have built up in them, or a feed bin or something's been put up outside. So any of these things can block the inlets, and that will prevent fresh air being drawn in. So if you've got a particular shed at home that you can say, oh, that shed's always bad for pneumonia, you always get bad pneumonia in that shed, have a look at the air vents. So have a look at the inlets and the outlets and see if they could be improved, because 9 times out of 10 there's always a way that a small improvement can be made, just by lifting this outlet a bit or taking it away completely, making your inlets a bit bigger. And the best news is that fresh air is free. So you just have to make good use of it. It's not often disease prevention is free, but fresh air is one thing that often is. So just make sure you use it. And just to give you a few basic figures to back that up, your outlet should be 0.1 metre squared for adult and 0.04 metre squared per calf. So that's per head of animal in the shed. And the inlet should be a minimum of twice the size of the outlet, but ideally 4 times. So you can quite often do some pretty quick calculations to see if your shed is well set up or not. And often shed builders will build sheds that look really pretty, but there's no outlet at the top. Often the complaint is it just lets rain in. When we often suggest to farmers, you need to take that ridge off the roof, but it'll just let rain in. But you can get raised ridges that stops that, but still lets air out. So it's something to have a look at. It's important to watch out for very young calves. So you don't want drafts at calf level. So if you've got open-ended sheds, and a lot of folk think they're great for ventilation because they're letting a lot of air in. If you've got very open-ended sheds with bare gates, if you've got wee baby calves, they'll get drafts at calf level, so you might want to rubber line the bottom of the gates there, just so your calves aren't getting a chill. And it also depends on the pitch of the roof. So, you know, if the roof is really highly pitched and you've got little baby calves in there, they won't create a static effect because there's not enough body mass in that shed to push the air upwards. So there's other things that come into play as well. And there's a really good video on the FAST website just now by Jamie Robertson, which I would really recommend you go and have a look at, because this is his bread and butter is shed ventilation. So and he's a really entertaining speaker, so it's definitely worth having a look at. So this is just a picture of a shed from a pneumonia investigation that we did. So you can see just at the very left-hand side of the picture here, they've got an open ridge in this shed. And they have got inlets, they've got Yorkshire boarding here down the sides. But what I suspect has happened is this bit here at the right-hand side is an add-on to this shed. So the original ventilation wasn't sufficient because obviously there's a lot more area here that the air needs to come in to go up. So what they've done up here is they've added in a fan. So we've got a fan up here. So there's lots of different ways that you can adapt sheds that you've already got just to improve the ventilation a little bit. Okay, another thing to watch out for in sheds is excess moisture. There's definitely no shortage of moisture, certainly down in Ayrshire, and I guess you guys are probably the same further north. So increased humidity in sheds increases survival time for all the bugs, as well as increasing things like bedding costs. There's no doubt it has that effect. So it's a really good time of year to get water troughs checked. So the sheds may be sat empty all summer. Make sure your water troughs aren't leaking and are running fine. Fix any leaky guttering, downpipes, that sort of thing. That can really make a huge difference. It sounds like a really simple thing to do. But if you've got a deluge of water coming off a broken downpipe into a shed, you're not long in getting wet beds and just a really humid shed, which will just precipitate a pneumonia outbreak. Now, I put a star next to, you'll notice, water troughs, so check no leaking water troughs and clean them out at the same time. So this is just a bit of an aside, but the most common cause of abortion in beef cows over the winter is a bacteria called Bacillus licheniformis. Don't know if any of you will have heard of it. Hopefully you've had no need to deal with it, but basically it's a bacteria that we usually associate with mouldy silage. So mould on big bales on pit silage, this Bacillus bacteria is there, and if cows ingest it, then there's a risk that they will abort, and it's the bacteria that causes the abortion. Now, one of my colleagues did quite a lot of work in this, and really interestingly, she actually found more of the bacteria in slimy, dirty water troughs than she did in mouldy silage. So not only is mouldy silage a risk factor for abortions, dirty water troughs are actually a greater risk of abortions. So while you're checking that they're not leaking, just give them a quick clean out before you house your animals. It's a perfect time to get it done. And if it saves you one calf over the winter, then it's been well worth doing. Okay, so going on to more about increasing immunity. Another virtual hands up, who routinely clips backs at housing? So I'd hope that some of you already do. So if you don't clip backs at housing, then sweating animals in a shed, the first thing it does is waste energy. So they have reduced daily live weight gain because they're sweating, they're using energy. A chilled animal, an animal that's sweated that then cools down will become chilled. And again, it's more moisture in the shed, so you're increasing the humidity in the shed, you're increasing the survival time for all these pathogens. So just running the clippers along their backs at housing can make a huge difference. And it's a really good habit to get into. And I was talking to a group a few weeks ago, and we were even discussing, you know, some people even do it again getting towards Christmas time. So if they're going through hands for any other reason, just have a look at them. Are they needing clippers along their backs? Certainly will never do them any harm to do that. Okay, so we've covered a few practical ways to reduce pathogens, and now let's look deeper into how we can increase immunity. So this is going back to thinking about pneumonia as an umbrella term. And this is what you see on the outside. So this calf here, this is actually one of our calves at home. It's never hard to find a black and white dairy calf that's got a bit of pneumonia. So pop this slide up here. And we're just thinking about, so the calf presents looking a bit rubbish, coat standing up on end. It's obviously had increased lying times. It's got a bit of lesion on its back leg there. Just doesn't look that great. That's what you see on the outside. But I've just got the next couple of slides are more about what's going on in the inside. And I think it's really useful to think about that. So if you're eating your tea or you've got young kiddies hanging about, then just to warn you that the next two slides aren't for the faint-hearted. But I think they're worth having a look at. So this is what we see when we open up calves, and this is my bread and butter. This is what I do day in, day out. So this is a set of lungs. So we've got one lung here, and the other lung's just peeking out of the back here, and then the windpipe is here, so it's heading up here towards the tongue. And what we see here is you can obviously see that there's a line where this tissue at the front of the picture here, at the right hand side, is very dark red, and the tissue at the back there, so at the left hand side of the picture, is a much pinkier colour. Now, the tissue at the front here is damaged tissue, so that tissue would be completely solid. Excuse me, would be completely solid. If I cut a wedge out of that and popped it in water, it would sink because there is no air getting in that tissue, so there's no functional lung tissue in there. This stuff at the back here, the pinky stuff, is basically normal. So if I cut a wedge out that and put it into water, it would float because it is air in it. And the stuff down the bottom here, again, it's just on the margin of changing over between functional and non-functional. So I just think it's really, really useful for you to see that, because this is the reason why a JAG of antibiotics doesn't always work. You have to think about, what lung changes have happened and what needs to reverse to get that animal back to the way it was. So that's why it's really important to prevent this happening in the first place, because those lungs would not recover. There's absolutely no way that those lungs would go back to being fully functional lungs, and that animal would always be chronically, struggling for breath and ill thrifty. It just wouldn't grow into or produce what it should do. So that's a set of lungs, and this next picture is so this is a windpipe that's been opened up. So you can see hands here, and they're just opening up the windpipe, and you can see that this is all pussy, so all this yellow grotty pus. You can see that there's sort of blood blisters here that look really angry, and if you ran your finger along that, basically that would all slough off in your finger. So basically it's a really, really sore throat, horrible necrotic, what we call tracheitis, and this is typical of IBR. So if you've got an IBR outbreak, this is what happens, and this is why you have dead animals. So hopefully that's just giving you a bit of an insight as to what's going on inside, and that is exactly the reason why a JAG of antibiotics doesn't always work and isn't always the solution. So it's much, much better to prevent it happening in the first place. Okay, so investigating pneumonia. Hopefully some of you will have had, well, if you've had the need to have a pneumonia investigation, hopefully some of you will have involved your vet. So your vet can take bloods from animals to assess for exposure to all the different pathogens. So usually we'd do this for the viruses. You can see we'd usually do this in sort of middle-aged animals, so your young stock between sort of 8 to 12 months old. The reason we don't do it in baby animals is because they'll still have antibodies from colostrum, and older animals, there's a good chance they will have been exposed. So if we're trying to pinpoint the exact time when they're becoming exposed, we'd do it in younger animals. So they can take blood samples to assess what they've been exposed to on farm, and take swabs. So big swab goes up the nose, just like a COVID test, I guess. So swab goes up the nose, and with that we can culture bacteria, so we can see what bacteria are involved, or we can try and isolate viruses by PCR as well. So that's for an investigation and an active outbreak of a pneumonia, whereas your blood samples are for an investigation of a previous outbreak of pneumonia. Now, the big downside of doing the swabs is, as we've already said, a lot of the bacteria are found in healthy animals. So just because we do a swab and grow Mannheimia or Pasteurella doesn't necessarily mean to say that's what's involved in the pneumonia at the moment. So that's the downside of swabs. And then we've got my favourite part of my job is doing postmortems. So don't ever let dead stock go to waste. Would be one of my big messages. Use it to find out what's going on. It's obviously not going to help that animal, but it could help the rest of the group if you use that material you've got there. So using your vet to investigate an outbreak can help make more informed decisions of things like using vaccines. So most outbreaks, as we said, are multifactorial. They'll involve bacteria and viruses, but a lot of them will start with a virus, and then you get a secondary bacterial infection on top. And that sort of rumbles on until you get the chronic lung damage like the picture that we saw previously. So if you know what viruses are circulating on your farm, then you can use vaccines strategically to stop the initial viral infection happening. And this in turn will reduce your use of antibiotics, which will save you money and will reduce our reliance on antibiotics, which is what we should all be aiming for. So I think we've got a poll now. Laura, is that right?
Yes, we do. I'll just launch it just now. So we'd like to know if you routinely investigate the cause of pneumonia in cattle. So the options are always, often, sometimes, rarely, or never. So 47% sometimes investigate it, 27% rarely investigate pneumonia, 13% never investigate it, 10% always do, and 3% often.
Good. Okay. So there's a fair spread there. So hopefully after what I've just presented, the folk that rarely and never do will maybe initiate investigations if they have the need to, because the earlier you get in your investigation, the better. And we're often asked a lot of the time, what should my cut-off be? When do I investigate? Well, I would argue that your very first case is the one you investigate, because you don't know what first case is going to be the start of an outbreak. You don't want to sit on that first case and then over the weekend you have more than half the group go down with it and have dead animals. You'll never wish in hindsight, God, I wish I hadn't investigated that beast, because there's always information that you can find useful to use. And for the people that always do, sometimes do, well done. So that was to remind me to stop talking for the poll. So other ways to increase immunity are to think about what other diseases might be going on. Are there any other diseases that might be pulling these animals down and affecting their immune system? So this, hopefully, it's pretty obvious what this is. It's a calf's nose, and these little white wiggly things coming out of it are lungworm. They're not always as obvious as this. I've cheated. This animal was hanging upside down by its back legs and I was about to open it up, and that's when they come out their nose just by gravity. And I didn't even really need to post-mortem this animal to make a diagnosis, because that was my diagnosis. But my point is that when you're bringing them from grazing, if there's anything else going on like that, and we're coming on to talk about lungworm in a wee bit more detail soon, then that's not going to help. So get these things sorted out. And so this is that animal opened up in the lungs. So those are lungworms in the bronchioles, and they're just going to be stopping air getting down there. They're absolutely not going to be helping the situation. And the other big one to make sure that it's not a problem in your farm is BVD. So the pressure's been put on. We're getting well through the eradication scheme now, and often if we have an unusual outbreak of pneumonia in a shed, we think, well, what's going on here? There's something else going on here. Quite often we find there's BVD circulating in the group. So just make sure that you're doing your testing properly. If you're doing check tests, that you are actually testing the management groups that you should do. And yeah, just if you're suspicious, then investigate it. Don't bury your head in the sand about it, because it won't go away, and it won't be helping the situation. So now a wee change of scene, moving away from me harping on about pneumonia all the time. I've just got a few slides in worming cattle at housing. So basically, where there are grazing cattle, there are worms, and there are a couple of type of worms that we're more concerned about in cattle, but that doesn't mean to say that they all need treated. So what needs treated, and when do they need treated? So as a general rule, adult cattle develop immunity to gutworms, and treatment shouldn't be routinely needed in adult cattle. You can target treatment at those in poor condition when they're coming in, if they're a bit leaner, a bit scoury, but always, always, always treat on the basis of a worm egg count. So always have evidence that you need to treat. Because what happens is quite often we get blood samples in to test for Johne's disease, and the history is that it was treated for worms, 2 or 3 weeks ago, and it's not improved, so we'll test it for Johne's. So we report the result that this cow's positive for Johne's, and she's in a massive withdrawal because she's had a wormer, and they can't get it away, they can't do anything with her, so they just have to be culled. So that is my one big exclamation mark, is just always make sure you do a worm egg count on the faeces. It's not a difficult thing to do. You don't even need your vet involved. You can pop in a fecal sample to your local lab, or post it to us, and just know what's going on with them before you treat them. Young stock are a bit different, so particularly those that have just completed their first grazing season, they're the ones to pay close attention to, because they're the ones that are at risk of developing parasitic gastroenteritis. And that's not just at housing, throughout the grazing season they're at risk, so they're the ones to keep an eye on. So they might be scouring, they might have scoured during the summer, or they might have no clinical signs at all, and you might notice that they've not done as well as they should have. They've got reduced weight gain, or you might not have noticed because the whole group might be the same, but they could have been bigger and pushed on a bit more had they not had that worm burden. So fecal egg counts, hopefully some of you do them. As I say, they're dead easy to do. You can take the samples yourself. Fresh samples are best. So if you're handling animals, I would just herd them or flock them into a corner, let them stand for 10 minutes. The chances are a lot of them will lift their tails, and then just go in and lift 10 samples. And we prefer them in pots to gloves if possible. And the reason we ask for 10 samples is so that we can get an average worm count from the group of animals. So within a group, you might have an animal that's got 1,000 eggs per gram, and you might have an animal that's got 100 eggs per gram. And if you test any one of them, you will get a false representation of what's going on in the group. So that's why we ask for 10 samples. And then when we get them in at the lab, what we do is we take exactly the same amount of faeces out of each pot and we weigh it out. And then we do our fecal egg count based on that combined sample to make sure it's representative of the whole group. And this bottom right picture here, it's actually a sheep worm egg count. But you can see there's plenty of worm eggs here, different types of worm eggs, and some coccidia as well. So that's what we're looking at. Then microscope, we're counting them up and we're telling you how many are there per gram of faeces. Lungworm we've already talked about, so it's a wee bit different in that cattle don't develop immunity against lungworm, so it's always worth checking for at housing. And it's a wee bit different in that we're not looking for eggs in the faeces, we're looking for the larvae in the faeces, just because the life cycle is slightly different. But the good news is that most gutwormers will also treat for lungworm, but again, I would have evidence that you need to treat for either before you do. I wouldn't just routinely treat, because we're trying to protect the anthelmintics that we've got, and we don't want to overuse them. So just always have evidence that you need to treat before you do. So fluke is the ever-present problem. I'm sure you guys are as affected up there as we are down in Ayrshire. And I popped up this life cycle of fluke, which I'm sure you'll all have seen before. But the important bit, particularly at housing, is that it takes up to 12 weeks from infection, so from when the sheep or cow ingests the fluke, until eggs can be detected in the faeces. So if you're doing worm egg counts at housing, just because you don't detect eggs, it doesn't mean that there's not fluke there. So, they could be in that stage before 12 weeks where they've not started producing eggs. And to get around that, we've got a few different fluke tests that we can do. So as I say, we've got the fecal egg count. If there are eggs there, then there's adult fluke there, so you need to treat. There is another test called a corporate antigen ELISA. So this is again a fecal test, so you can submit samples for this. And it detects immature fluke, so we can detect that there are fluke there before they start laying eggs. So often if we get samples in that are negative for eggs, we'll offer if the corporate antigen ELISA would be useful because we can detect them sooner. But the basic rule for fluke is to assume exposure on the last day of grazing and make sure your treatment choice is appropriate for the stage of fluke present. So some flucicides will only do adult fluke, whereas some will do the more immature stages. So make sure you're using, there's no point in using an adult flucicide if you've only got the immature stages there, because it will have no effect whatsoever. And a lot of people will wait until they've been housed for 12 weeks and then test and treat based on those results. And this link down here, so the cattleparasites.org.uk, is a really good resource for just anything about cattle worming at housing. It's similar to SCOPS. If you've been on the SCOPS website, that's the sheep equivalent, and the cattle parasites is the cow equivalent. So that was just a wee bit on worming and fluke at housing. So we're moving on to lamb deaths now. I mean, it's a bit of a morbid subject. We always like to talk about healthy animals, but it's just quite a few interesting points I've got to raise. But I think we've got another poll to begin with, have we, Laura?
Yes, we do. I'll just launch it just now. So we would like to know if you routinely investigate lamb deaths over winter. And once again, the options are always, often, sometimes, rarely, or never. So 44% of our audience tonight rarely investigate lamb deaths over winter, 22% never, and then joint on 13% is sometimes and always, and the remaining 9% are often investigating lamb deaths over winter.
Okay. I think that would be consistent with what we see in the postmortem room. Often it's, the fifth or sixth lamb that's died that we get in when they start to worry about it. And I know at home as well, we've got a lot of store lambs running here, and you get dead one, no, it's just a store lamb, but the price of them this year doesn't take a lot of losses to fairly add up, and you don't want, like I was saying earlier, your first one could be the start of an outbreak. So yeah, my argument would be to investigate the first one before it becomes a real problem. So just continuing on the fluke theme, just to ease us into sheep a wee bit. So fluke in general is a much more of a problem in sheep and lambs in particular at this time of year. Acute fluke can be a big killer. So what happens is they ingest a lot of immature fluke, and these migrate to the liver as fluke do, and their aim is to get there and to go into the bile ducts and mature and lay eggs. But what can happen is if a lot of these immature ones get to the liver at the same time, they basically munch through the liver tissue and burst the liver. So the liver ruptures and the animal bleeds to death. And that's when you get your sudden deaths. It can also cause weight loss and scour. And as I was saying, you only get fluke eggs in the faeces 12 weeks after infection, and that's what we term chronic fluke. So that's the difference between acute and chronic fluke. But in this time of year, it's acute fluke that we're more worried about in lambs. And we've got a beautiful picture here of, this is a liver, which is very, very pale. So it would normally be a much redder colour than this. And we've got a nice blood clot sitting here and a pool of blood. So basically that's exactly what's happened here. This liver has ruptured and the animal has bled out due to acute fluke. And you can see all these little purple tracks on the liver. So these are from the actual fluke migrating through that tissue. And this is a dead easy thing to diagnose. If you have a dead lamb, if you're brave enough, you can quickly open it up, get your vet to quickly open it up. As soon as you open up and see that pathology, that's what that lamb's died of. You can go and be treating the rest of the group to make sure you don't lose any more. So that would be my argument in opening up the first one. Don't wait until you've got 10 dead before you start doing that. Get on it at the first one. So PGE in lambs, parasitic gastroenteritis, can cause ill thrift. It can also cause deaths, and it's always the first thing that I would want to rule in or out in a group of pure doing lambs, or if you're getting deaths and you open them up and you're not seeing anything obvious like your acute fluke. And I just thought it was worth drawing this to your attention tonight, because we always see a peak at this time of year. So you can see the graph here shows year on year continuously we get a peak of parasitic gastroenteritis diagnosis in October, November, getting towards the back end. Some years are worse than others, and that is purely based on weather conditions. So wetter years, poorer years. If the lambs are going into winter having had a rubbish summer, then they're going to be more predisposed to it. And the pasture is going to be poorer, and they're going to be more prone to picking more worms up. So year on year there are differences, but continually we always see a peak at this time of year. So yeah, if they're not doing well, then I would always want to rule out worms, even if they have been dosed. So anthelmintic resistance is on the rise, and we need to be aware that that is a possibility. And that's why the worms haven't responded. And as I was saying before, the SCOPS website is a really great resource to go into, have a look and develop a strategic worm management plan. So that's one thing that can be going on. This picture here, so this is the inside of a sheep's stomach, and these little worms, the little red things here, are homunculus worms. And I just thought this was worth bringing to attention as well. So homunculus is something that we've historically seen in the summertime and really warm months, and usually we only see it certainly in Ayrshire in animals that have been brought up from down south, so animals that have come from warmer climates up to here. But this year, for the first time ever, we've actually diagnosed it in a few homebred animals, so they've picked it up at home. So it's just something that's on the rise. And what these animals, what these worms do is they attach to the stomach lining and they actually suck blood, so they'll make the animal anemic. So the ones that we diagnosed it in were, one of them was a sudden death actually, and the other ones were just a bit wobbly and a bit scoury, but just not right and not doing. They had poor coat, and were quite thin. So it's just something to be aware of, particularly if you're bringing stock up from down south, that you don't want to be bringing homunculus onto your farm. And I think it's something that's going to become more prevalent and move up the country as years go on, unfortunately. So pine, otherwise known as cobalt deficiency, is another thing that we see shooting up at this time of year. Now this graph could be falsely represented because we are sampling for it at this time of year, because we know what happens at this time of year, so of course we're going to diagnose it more at this time of year. And we also have the at-risk group of lambs at the right age at this time of year. So it's not particular that they become deficient magically at this time of year for some reason. It's more that we have the at-risk population about at this time of year and we're testing them. So cobalt is used by the rumen bugs to produce vitamin B12, which then goes into lots of different cycles for energy metabolism. Now, we don't have any way of measuring blood cobalt directly, so instead we measure vitamin B12, and if vitamin B12 is low, then the likelihood is that they're deficient in cobalt, which is required to make the vitamin B12. So lambs that are deficient in cobalt can be a bit listless, poor condition, poor wool. That's quite often what you see. And it also, really importantly, leads to reduced immunity, so that leaves them vulnerable to lots of other diseases. But supplementation of trace elements should only be done based on diagnosed deficiencies. And I think I've got, so I've got a picture. These are some lambs, store lambs we were sorting out, and this little guy here is just half the size of the rest. And because he was the only one, we didn't actually test him because we weren't going to be supplementing the whole group anyway. But if you had a group that just weren't doing as well as you hoped they would be, then I would be a bit suspicious of pine. But yeah, supplementation should be done on the basis of diagnosed deficiency, and be careful where you put it. So this picture here is an esophagus. So this is the throat, this is the larynx basically, and the esophagus is lying on top of here, but it's been opened up, so there's been a pair of scissors run up the esophagus, and this dark hole here is into the windpipe. And this is a post-mortem we had in because this lamb had died and they wanted to know why it died. Well, this is why it died, because it had been supplemented with a bolus that had been put in completely the wrong place. So this is more common than you would think it would be. a lot of these store lambs are quite small and the boluses can be quite big, so just be really careful when you're putting them in. Make sure you've got the correct size gun and you're not compromising by leaning over equipment, leaning over gates, that sort of thing, and doing it from awkward angles. Just take your time and make sure it's going in gently and going into the right place, because that's a needless death that doesn't need to happen, but it does happen more often than you think, and it's not easy dosing these lambs, but it's just to make you aware that can happen. So we also often get a lot of lambs in over the winter, or a lot of presumed diagnoses of Pasteurella over the winter. So just to split it up a wee bit, you'll get pneumonic Pasteurella, so that's where you've basically got Pasteurella bacteria causing pneumonia in the lungs. Often you'll more get that in ewes than in lambs. And then we get Pasteurellosis, which is where the bug has basically got into the bloodstream and gone awry. So that's a septicemia, and that's often why these lambs die. The question that we always get asked, you've diagnosed this lamb with Pasteurellosis, but it's been vaccinated. I've got a picture of a vaccine there, other vaccines are available. So why do vaccinated lambs still die? Well, there are reasons. So they need a course to be finished 2 to 3 weeks before the risk period starts. So that's really hard to fit in the management year. There are multiple different Pasteurella strains, not all of which are contained within the vaccine. And concurrent disease, this is a big one, might affect the immune system. So if these lambs have a worm burden or are deficient in trace elements such as cobalt or selenium, then their immune system isn't working as well as it should do. And even if you're putting vaccines into them, their immune system's not going to respond to that vaccine, so they're not going to get the protection. So that's a big one, to make sure they're on tip-top form before you vaccinate them. And the final one is, has the vaccine been stored properly? So has it been in a pickup in the sun, warm? Has it, had a couple of days out in the shed where it's been colder than it should be? That sort of thing. It is quite important to keep these things in the fridge as they should be stored. And the good news is that actually not, the biggest peak of pasteurellosis isn't actually in the back end like a lot of people perceive it to be. We actually have a bigger peak in the early summer months, but we do still have a peak in the autumn months, so it is still a possibility. But there's lots of different reasons why you might lose lambs over the winter, but I think the important thing is to investigate it and know what's going on so that you can try and put into action something. Even if the horse is already bolted for this year, you could do something for next year to try and stop it happening again. So I've just got a few slides to finish off, just on making the most of cull ewes. So I appreciate the time's maybe passed a wee bit for this year, and that you'll maybe already got rid of your cull ewes before tups go out. But they're so useful to use as a quick look-see to see what diseases you've got in your flock. So the big one would be OPA or Yagsikte. So it's basically a virus that causes tumours in the lungs. The problem is that we don't have currently a blood test or anything that diagnoses it, and the only way to diagnose it is at post-mortem. And sadly, often we diagnose it at post-mortem, and that's the reason for the animal's death. And often the farms do diagnose it and weren't aware that they had it. And it can take the incubation period long, so it can take a couple of years to develop lesions in an animal, but by that time they've passed it around a lot of the other flock. So and infected a lot of animals before they actually come down with it and are diagnosed with it. The only other way to diagnose it currently is to ultrasound lungs, which a lot of vet practices are starting to do, which is really good. And I see a lot of tups being sold this year. They're saying at sales that they've been scanned for OPA, which is really good. But in a commercial flock, that's not always practical to do that. And if you do have ewes that are going anyway, it would be worthwhile just having a look, see what's going on in there. And Johne's and Mighty Visna are the other two big ones as well. That it's difficult to diagnose these diseases on a flock level, and if you've got ewes going out the flock, then it's useful to get that information from them. It's not going to help that ewe, she's going, but it will give you information that you can then take back to the rest of the flock and think, right, well, how can I prevent more animals becoming infected with that now that I know they've been exposed to it? And The other thing it can be pretty useful for is a quick trace element screen. So when we do blood samples for trace elements, so we're talking about copper and selenium and cobalt, really, that's what's circulating in the blood. But a lot of these trace elements are actually stored in the liver. And what we measure in the blood isn't always representative of what they've got stored in the liver. So the liver can actually be a more accurate way of screening for trace elements. So a lot of people will use cull-use for that purpose as well. So what use do you choose? So we'd want the ones that are obviously going cull. So skinny ones that have got no obvious reason. The last thing you want to do is to submit a ewe for post-mortem, and we come back and say, well, we didn't find anything apart from the fact she had no teeth in her head. You know, you can see that before you send her. So if there's an obvious reason for her being skinny, she's probably not the one to select. But if they're skinny, especially if they're still young, you know, if they're going cull before they should do, then there could be Yonis or Mydivisner or OP in there, and it's, you know, worth submitting them to check that out. And make use of other dead stock in this way too, so not just your cull ewes. You know, anything that dies on the farm, you can find out so much from it. Like old ewes that have died on the farm, quick look see to see if they've got OPA, then you know that's in the flock and you can do something about it. But on the flip side of that is think about what you're going to do with the results. So if you're an open flock that buys in draft ewes every year, you're going to have to continually do that to keep your system going. Then there's not a lot you can do to not buy in some of these diseases. So yeah, I mean, just think about what you'll do with the results when you get them. Is it practical for you to be putting in control programs and culling sheep out on the basis of the results you get, or are you going to have to buy in anyway, so it's not an option for you? But it's just something to think about. It's a useful tool, and we do have more and more people doing it. So that you'll be glad to know that is me finished talking. Hopefully you've all taken something practical away from that. Like I say, I tried to make it a bit more practical because I like going outside and doing stuff on the basis of talks that I've heard. So hopefully that's what tonight's been. And yeah, I'll just take any questions that anyone's got gladly.
Right, thank you for that, Megan. That's a really interesting, informative talk. So just get your questions in. We've got a few moments for them, so we'll just get started. So we've had a few people that have investigated pneumonia in the past and had some of the bacterial and viral causes that you mentioned earlier diagnosed in their herd. Does that mean that those will be a problem again this year?
So it depends on your herd dynamics. I would say if you're buying in stock, then there's always the risk that you'll buy in different pathogens. And like I said, a lot of them are in healthy animals anyway, so a lot of them will be there all the time. And if you've diagnosed, say, if you've found IBR on an investigation and it's in homebred animals, then yes, that's in the herd. So it is likely to be a problem year on year. So it's worthwhile thinking about doing something about that. But yeah, it very much depends on your herd dynamics and even where they are during the summer. So if they've got nose-to-nose contact with other animals over the fence, they could be bringing back other pathogens, you know, year on year into the sheds. So it very much depends on your setup.
Good. And you kind of try to encourage everyone to get into pneumonia vaccine investigations. So how many individuals would you need to sample, and what is the cost of a typical pneumonia investigation?
Good question. So in a group would usually say, you know, if you've got a clinical outbreak, if you've got sick animals, then you want to be testing the ones that are newly sick, so the ones that are in the acute phase of disease. So it depends on how big the outbreak is, how many you'd sample in that situation. If you are doing blood samples to screen what is going on in a group, so what they've been exposed to previously, there's not currently a problem, we'd probably say about 5 to 10% of the group would be ample if they were all well mixed together. So just about the same sample size as you use for your BVD check test, that sort of thing. And some people will actually submit their BVD check test and run respiratory serology on the same samples so they can see what respiratory viruses that group's been exposed to. When you're talking about costs, so this is just off the top of my head, in a in an outbreak situation where you're trying to get viruses off of a swab that's been up a nose, you're talking about £35 for the PCR, and that looks for 3 different types of viruses. Whereas a post-mortem for an animal under 6 months old is £56, and that's all that testing included. So your post-mortem is actually better value if you are unfortunate enough to have some dead stock. Your post-mortem will be better value for money than doing individual tests. And your blood samples to check for exposure can range anywhere from £20 to over £100, based on how many different antibodies you're looking for, and some people will just do one blood sample on one day, so that'll give you a snapshot of what they've been exposed to previously. Or if there's an outbreak ongoing, they might do what we call paired samples. So you'll sample the animals on one day and follow them up with a second sample 3 weeks later, and you can see if the antibody level to all the different bugs has increased, and that gives you more confidence that that is currently what is causing disease in the group. So if you do that, it'll be slightly more expensive, but again, even at just over £100, if that's really good value for money if you can then save an animal or strategically introduce vaccine that you know is actually worthwhile using.
Yes, and with another question here, is there a vaccine available for Mycoplasma bovis now?
Okay, so there's not a commercial vaccine available, but we do have farms that have had mycoplasma problems, and what they've done is they've submitted postmortems to us, and we have isolated the mycoplasma from lung tissue, and we then sent that to a lab to get a vaccine made, and they are now be-injecting that into their animals. So you can get one made up, but there's not one in this country that's commercially available at the moment.
I think you're allowed to get one under the special import certificate. Some vets up in this area are starting to import it from America.
Yeah. But yeah, it's off license. You have to do it with your vet, and again, you'll have to have proof that you have it on your farm. So you would have to initiate the investigations and confirm its presence before you'd be allowed to do that. So there are options for controlling mycoplasma.
And we've got a few questions about worms and flukes. So we'll just start with what's the best time to do fecal egg counts and how much do they cost? And at housing, is it better to treat immature rather than the adult fluke?
Okay, so the fluke question first. At housing, you've got the luxury that they're no longer being exposed to fluke. So what you're probably best doing is to house them and allow any immature fluke to become adults. So house them for that 12-week period and treat them there to make sure they're well cleared out. Again, it depends on your farm situation, because if you have known resistance to some flukicides that do immature fluke, so I'm thinking triclobendazole, if you've got triclobendazole resistance, you want to be staying away from that. So again, you would be better to house, wait till they're adults and use a different type of fluicide. So it depends on your situation and if you're able to remove them from exposure or not. And what was the other question about costs of fecal egg counts and when best to do them? So your bulk fecal egg count, off the top of my head, is roughly £25 to £30. So it's not a lot. That's 10 samples, and you get your bulk count back. And you're best to do them just at housing. Just when you're bringing them in. What you don't want to be doing is using products that's costing you money when you don't actually need to use it. So just I'd advise to get some samples in, do your fecal egg counts at housing, and just treat based on those results.
Yeah, and I think we'll have time for another couple of questions, so if you just get them in now, but we'll just go with this one here. Someone is asking if cattle have already been treated with lungworm and tested clear, and then when they house them, should you treat them again?
No, there's no reason to. The lungworm risk period is generally sort of late August, early September. That's when we start seeing it. But if you've already treated them, might be worthwhile doing another fecal egg count just to check at housing, because as we said, lungworm can complicate pneumonia outbreaks. But unless they've been exposed to a really high burden between treatment and housing, or it's been a very long time, then no, they shouldn't need retreated.
Yeah. And at what point should you intervene in any of these kind of diseases that we've discussed? tonight, and when should you call your vet?
So I'd say gold standard is with the first case, but I totally realise that's not always practical. And often you might get a calf with a bit of a cough, you jag it and it gets better, great. But my argument would be, like I've said all along, that you don't know what is going to be the first case of an outbreak. So even if you don't get anyone out to the first case of anything, the first dead lamb or the first coughing calf, it's still worth having a chat with your vet, so that you're armed with information that you can then put into action when the next case occurs. So they're aware of the situation, and you can get a postmortem done or get some bloods done with the next case to find out what's going on. But the earlier the better would be my advice.
Yep, so I think we're kind of rapidly running out of time, so we'll just finish off with one last question. But there are a few questions we haven't answered, but as I said before, we will endeavour to get back to you over the next day or so. But so finally, Megan, if you were to kind of give everyone your key messages to take home from tonight, what would they be?
So I think investigate and know what's going on in your farm. Doesn't matter what's going on in your neighbour's farm, know what's going on in yours. And my second key message would be, don't waste money on treatments that you have no evidence for using. Make sure you've got that evidence for using them, and you're not wasting money or contributing to anthelmintic or antibiotic resistance. It would be my 2 take-home points, I think.
Good. So thank you for answering those questions, and once again for that really interesting presentation. And hopefully you'll be able to join us for the next webinar in this series next week. It's next Monday at the same time, and we'll be looking at Is the Grass Always Greener, with a panel of new entrants from across Europe. And this is followed by the following week with beef production South America, and then the week after with Bounce Back from a Crisis. And all of these events are advertised on the FAS website, where you'll find further details. So I'd just like to thank you for coming along tonight, and good night.